Hey everyone, it's Jason Bradley from BodyWorx Physio, here today to talk to you about cortisone or corticosteroid injections. So basically, what is it? How can it help you? What are the risk factors? What are the risks with using it? And what sort of conditions would you consider it for? So what is cortisone injections? So cortisone or cortisol is a hormone released by the body in response to stress. So the adrenal gland produces this hormone as a natural anti-inflammatory. It's synthetically produced cortisone, mimics the natural hormone produced by the body. However, it's generally stronger and longer lasting, and also when it's used, it's made in far higher doses into that specific area, especially when it's injected. Cortisone injections can be used to provide short-term relief for inflamed areas in the body, and they are not pain relievers. They only work to relieve pain when there's inflammation in that site that is causing the pain. So they themselves are not a pain reliever. However, they often do have anesthetics or locals introduced with the injection if you're getting it as an injection. Cortisone can be taken orally, inhaled, applied to the skin, or injected. So what conditions can cortisone injections be used for? Corticosteroids can be used to treat areas with local inflammation or widespread inflammation. So there's multiple uses for them. So they can either be done as local injections, like joints, bursas, or into specific muscles, or they can be taken oral or inhalation, as we said. So conditions that may require local injections can include things like bursitis, tendinitis, joint pathologies such as osteoarthritis. Conditions that may require systemic injections or inhalation or pills or tablets can include allergic reactions, asthma, and rheumatoid arthritis. So, an example of various conditions that we as physios treat that are sometimes treated with cortisone injections include things like tennis elbow, golfer's elbow. So that means your lateral and medial epicondylalgias or epicondylopathies, as we like to call them. Bursitis is the hip, knee, and shoulder, so the small little fluid-filled sacs that protect things in there. Frozen shoulders, plantar fasciitis, that's where the arch of your foot gets inflamed. Carpal tunnel syndromes in through the wrist, herniated discs in the back and neck, and rotator cuff injuries. So with any medical intervention, or anything really, there's always pros and cons. So what are they? So with cortisone injections, the pros or the good things about it are it reduces inflammation. There's a rapid onset of relief. It's easy to administer. The substance is well tolerated by most patients. And it's quite easy for patients to have access to it. So you can talk to your GP, and if the GP finds that it is indicated, usually they will do a combination of clinical tests plus looking at ultrasounds and that to show that the structure is inflamed. Then it's quite easy for them to refer you for that, and a lot of that cost is generally covered by Medicare. So it's cheap and easy to get access to. But what are the bad things about it? So short-term complications of it can include infection, local bleeding, nerve damage, soreness at the injection site, reaction to the corticosteroid, tendon weakening or rupture, temporary increase in blood sugar, fascial flushing, so irritation of the fascial over the area. Uncommon side effects, though, can also include sweating, dizziness, nerve damage, and insomnia. And we always have to say all those massive long line of possible side effects. For the vast majority of people, there are no bad side effects. It is realistically a reasonably safe injection, but those are the possible things that can go wrong. Long-term complications can include, and they are dependent on the dose and frequency of the injections. Thinning of the skin, so especially if you're applying it topically, easy bruising, weight gain, we find that's more when you're taking it as a tablet. Acne, blood pressure elevation, cataract formation, osteoporosis, osteonecrosis, which is death of the nearby bone, and reduced effect after the first injection. So we are careful about when they're used, how often those medications are used, and what structures they're used on or injected around. So for example, the fat pad in through the knee, they rarely inject that with cortisone nowadays because they know that there is an increased risk of that fat pad actually dying back after that injection. So it's generally not used for that reason anymore. So what are some of the results that can happen? So The outcome generally depends on the condition that you're using it for, like would be expected. So a typical response, though, is sometimes an increase in the pain or inflammation for up to 48 hours. And this is because we've injected into an area. But then some people also find that they get immediate relief. That often will be because there is some local anaesthetics applied with the injection as well. So most of this stuff I'm talking about is for injections, which is what physiotherapists generally deal with the most. So that reduction in pain after that initial irritation can last anywhere from a couple of weeks to several months. We often say that there's three options of what will likely happen with an injection. It will either get better and stay better, it'll get better and then come back after a little while, or it will do nothing at all. The big issue with this is they often only provide temporary relief. So even though you're getting that injection and it may reduce the pain, we still need to fix the biomechanical reason, the background reason for why that irritation has come on. So if that's something like the shoulder, you're still wanting to stretch out any tight muscles, strengthen up those joints, strengthen up the rotator cuff muscles around it to make sure the shoulder's moving in the right position. If that's to do with the knee, just happen to have one here, it still means loosening off the outside of the leg, building up the strength of your inside quad, developing your glutes and your core control so that that knee is properly supported. So that's really important. So what is the evidence behind it? So there's heaps of studies on it. And like most medical conditions, there's varying level of evidence depending on the study. Studies with patients with tennis elbow have found that patients receiving cortisone injections improved better in the short term compared to patients that were receiving no treatment at all. That's not exactly a great sort of recommendation because also patients who receive stretching and that also improve better. So we would always say that they are a great tool to look at using if your condition is not responding to standard conservative treatment. There are risk factors with any medical intervention or any intervention, whether that's physiotherapy, surgery, any medication. So you've got to always make sure you talk to your physio and your GP about what is appropriate for you, what is best for your condition. But generally speaking, we're going to look at treating any condition conservatively first with physiotherapy to get the biomechanics and the background reason for why that inflammation is there sorted out. And then if it's not responding, for most of our conditions, we say if it's not responding within 4 to 6 weeks, we look at moving it on to some extra imaging, possibly the injection, or if it's indicated, you may be referred on to your specialist by your GP to speak about surgery options or other injection options. So I hope that's cleared up. Remember, whenever you're looking at these injections, they should always be done and referred by your GP. They should generally always be done under guidance because that makes sure we get the correct structure when we're putting it in rather than just hoping that we're hitting the right spot. And if you have any questions, please speak to your GP or your physiotherapist about it. If you need to see us about any problems or conditions, please give us a call on 4952 7033 or jump onto our website bodyworxphysio.com.au and you can book an appointment online there in 2 minutes. Thanks and have a great day.